प्राणो हि भगवान् मातरीश्वरम् प्राणे भूतं च भव्यं च प्राणे सर्वं प्रतिष्ठितम् प्राणो हि भगवान् मातरीश्वरम्.
Welcome, Dr. Lad, to After Hours with All About Eve. It is such a privilege and honor to have you here. I have had, as I said, the privilege and honor of coming to the Vasant Institute of Ayurveda for many years and learning about Ayurveda from you, practicing Ayurveda from you. And so it was very, very high on our bucket list to actually have you on our show so that we can educate the youth and everybody else out there as well about the magic of Ayurveda. So thank you for spending some time with us.
You're welcome. Thank you.
You know, Dr. Lad, given, as I said, my experience at VIOA and, the number of years that we've been associated with it, I've personally benefited so much, just from following the principles of Ayurveda. If we were to explain to a girl like myself or someone who's in their 20s or 30s, what is the most basic understanding of Ayurveda? What is Ayurveda?
Very beautiful question. And it's a vast answer, but I will make it short.
Yeah.
As you know, the word Ayurveda is derived from two roots. Ayuhu means life, and Veda is knowledge. And knowledge which is systematized becomes science. So later Ayurveda became the science of life. What is life? Life is our daily existence. Life is our relationship. Life is togetherness. And life is functional unit between the body, mind and consciousness. Sattvam atma sharirancha trayam etat tridandavat. Sattva is mind, atma is conscious principle, and sharir is a physical body. So we are born with a unique body. We all are individual. And the word individual means indivisible, undivided, total, unique expression of consciousness. So, to understand the individual as he or she is, that is called Prakruti. And Prakruti is your blueprint. It is your genetic code. And Prakruti is your uniqueness. And to understand your Prakruti, and then as the time goes, the age, the seasonal changes, dietetic changes, change in the environment, and change in the emotion, our bodily dosha, Vata, Pitta, Kapha, they undergo change. And this altered status of Vata, Pitta, Kapha is called vikruti. So Vata is the principle of movement. Okay. I'm talking because of Vata. I'm moving my hand because of Vata. Sensory stimuli, motor response is Vata. So Vata is neuroelectrical impulse that maintain all voluntary, involuntary action, all sympathetic and parasympathetic movement. Even movement of RNA, DNA is governed by Vata. Movement of cytoplasm, movement of chromosomes, all these bodily movements is Vata. And Vata is the principle of movement. Second important dosha is Pitta. Pitta, Tapa. Tapa is austerity. Pitta, Tapa. Tapa means to heat. So there is a heating factor of the body which maintains body temperature, color, complexion, luster of the eyes, understanding, comprehension, appreciation, recognition and realization. All these factors, they are Pitta, and Pitta governs body temperature. Pitta creates hunger, Pitta creates thirst, and Pitta does digestion, absorption, assimilation and transformation of food into microchyle. Microchyle is ahara rasa, that Pitta factor is very important. And third is Kapha. Ka, fa, kena phalati iti kapha. Ka means water. And pha means flourish. That which gets flourished by water is Kapha. So Kapha is a building block material. So we are carrying these three factors, V, P, K, V for Vata, P for Pitta, K for Kapha, and that unique permutation and combination of V, P, K, Vata, Pitta, Kapha is the Prakruti. So Prakruti is our nature. Prakruti is our response. There is always, they talk about three responses: fight, flight, or freeze.
Yeah.
So Vata person will take a flight and leave the place. Suppose there is a big cobra comes in this room. Vata person, just by looking at cobra, he will break the window and jump out. Or he'll pass out. Means he runs away the situation, that is a Vata. Pitta person, when he sees the cobra in the house, he will take a chair, take something to kill the cobra. And Kapha will not participate in the killing. He will sit in the corner, and from the corner, Kapha person will shout, tell the Pitta person, kill him, kill him, kill him. So this is flight, to run away from the situation, which is Vata. Fight is Pitta, and freeze is Kapha. So these Vata, Pitta, Kapha, these are the three organizations. They govern our unique psychophysiology, our unique psychology, and our unique personality. Your personality is colored by Vata, Pitta, Kapha. So Ayurveda is the art of healing the body, mind, and consciousness. Vata physically expressed as bodily expression, color, complexion, body frame. Same thing, Pitta has a different color, complexion, different frame, and Kapha has a large frame. So when person is skinny, mini, teeny, tiny, that is Vata. Always fiddling with the finger. If there is nothing to do, he will put finger in the ear and he will do dry cleaning of the nose or putting finger into the ear. So these activities are Vata. Pitta is very bright, brilliant. They will take the note, they will read the magazine, or they will tear up that piece of paper, carry or take note. So Pitta people are very knowledgeable. They want to learn, they want to study. Vata person will play with the book. He will just see how many diagrams are there and close the book. But Pitta person will read the book completely, take notes. They are highly knowledgeable. And Kapha person will open the book and there is nothing much to read. He will put the book on the chest and he will sleep. So Kapha people love sleeping, they love inaction. So these are subtle characteristics of Vata, Pitta, Kapha as a psychophysiology is concerned. In the human body, Vata is present in the colon, Pitta in the intestine, and Kapha in the chest and the fundus of the stomach. So Kapha, Pitta, Vata.
So basically, if we were to simplify everything that you've said, then we as human beings are born, like every human being is unique. We have a unique thumbprint, we have a unique structure of Vata, Pitta and Kapha, which are the three doshas as per Ayurveda. And those doshas not only determine our health, but also our personality, as you said.
Correct.
As you just said, a Vata person is probably going to skim through a book, a Pitta person will read it with diligence, and a Kapha person might just put it on their chest and go to sleep, right?
Correct.
So, Dr. Lad, you know, as you said, seasonal changes, etc., life in general does create a, kind of imbalance in these doshas from time to time. What does one do then to actually go back to their Prakruti, which is what we were born with, from their vikruti, which is what we have become?
Vikruti is the present status of the Vata, Pitta, Kapha. For example, I am reading my own pulse.
Yeah.
And the spike, under each finger, there are three curvatures: proximal, middle, distal. Proximal means towards heart, middle is middle, distal is away from the heart. So here in my pulse reading, I am reading how many Kapha spike, how many Pitta spike, how many Vata spikes are happening. So I am getting Vata under index finger and Vata under middle finger at distal curvature. So my Vata is 2. But under central curvature, under each finger I get Pitta spike. So my Pitta is 3. And Kapha spike is only one spike under ring finger proximally. So my Prakruti is Vata 2, Pitta 3, Kapha 1. This is my genetic code.
This is mine too.
Yeah, that's good. So this Prakruti, now I'm just deep pulse correspond to Prakruti. Now superficial pulse correspond to the vikruti, the present altered status of the dosha. See, my Vata is high. I get one spike of Vata under index finger, middle finger, and very delicate spike under ring finger. So my Vata is high. That's why my throat is dry. I'm constantly doing that. So this is all Vata. My Vata is high, 2.5. Pitta is same, 3. Kapha is same, 1. So this altered status of the Vata create dryness of the throat, dryness of the colon, dryness of the joint, cracking of the joint, popping of the joint, knee pain. This is all Vata. Pitta will create hives, rash, urticaria, acidity, indigestion, or temporal headache. And Kapha will create common cold, congestion, cough. So, when we feel the vikruti, the present altered status of the dosha, in my case, my vikruti is, Vata is high, 2.5. Then I have to take a sip of water, because Vata is dry. I have to
counter
calm
it
it down
liquid.
with the treatment. Or I ask them to give me little clove. Clove has oil and clove is very sedative. Or taking rock candy. So these are very simple remedies that will calm down Vata dosha, and my throat will be warm and I can talk without clearing my throat. So this is one simple example. Ayurveda is a science of balancing dosha. We have to bring vikruti back to the Prakruti. Prakruti is your standard. Prakruti is your scale. Prakruti is your meter, barometer. And if you know Prakruti and if you know vikruti, then you will bring the vikruti dosha back to the Prakruti. This is called chikitsa. Chikitsa means treatment. Chikitsa means management. Chikitsa means balancing Prakruti, vikruti paradigm. That is the basic paradigm of Ayurveda.
Perfect. So if one has to do that, then all they need to do is go to an Ayurvedic practitioner and they will know what is not in balance, and then they will be recommended herbs based on that or suggestions based on that to get them back to their Prakriti?
Correct. You know, Ayurveda is not only philosophical, but it is practical, clinical science, clinical evaluation. Darshanam, sparshanam, prashnam. Etat trividam rugna parikshanam. Rugna means patient, parikshana means examination. So we examine the patient by darshan, observation, sparshan by palpation, and prashna by asking question. So, in this observation, if Vata is high, so Vata creates certain symptom. For example, constipation, gas, bloating, cracking of the joint, popping of the joint, ringing in the ear, insomnia, anxiety, insecurity. This is a group that shows Vata is high. Pitta, if Pitta is high, person will get acid indigestion, heartburn. It will also create sometimes rash, urticaria, hives, and dizzy spell, insomnia. Insomnia of Vata is throughout night there is no sleep. But insomnia of Pitta, people get sleep between 10 to 12 and 12 o'clock he is awake. Then whole night there is no sleep. That is a Pitta. We give treatment according to the dosha. Insomnia of Vata has different protocol and insomnia of Pitta has different protocol.
So it's very individualistic.
Absolutely.
It's not a one-size-fits-all solution like allopathy might offer.
Correct.
Right? Like they would test, let's say, a certain medicine on a set of people, and I feel like that advice might be slightly more generic, and I think when you consult an Ayurvedic practitioner, that advice might be slightly more specific to just your body constitution.
Absolutely. What you say is very true, because in modern medicine, they do statistical observation. What is common in 100 people that karma is called normality, and they try to bring every person into that standard of commonality, normality, which is their standard, and that's why it doesn't work. It doesn't work means it works for people, some people, but for some people it get hazardous side effect, reaction, because in modern medicine there is no consideration of individual. Now they are doing. There are so many drugs, antihypertensive drugs. Tenormin is not going to work for everyone. Amlodipine is not going to work for everyone. Now they are thinking that every individual is unique. I'm thankful to the doctors and modern medical professionals. They are slowly coming to the Ayurvedic platform to say that every individual is unique and we have to study every individual separately, and based upon individual's paradigm they prescribe drug. But this is very ancient Ayurvedic thought that every individual is indivisible.
You know, Dr. Lad, you just mentioned Western medicine. And there's this constant debate, where we kind of pit Western medicine against Ayurveda or vice versa, where we think one is better than the other. What is your take on it as, an Ayurvedic doctor and practitioner since so many years?
I have studied modern medicine as well as Ayurveda. I love modern medicine. Beautiful. For emergency, severe heart attack, stroke, paralysis, fracture, there is nothing like modern medicine. So, we should not create division between modern medicine and Ayurveda. Both are medical sciences and both have their own philosophy, both have their own theory, practice, which is beautiful. One thing is very important, most of the modern drugs, they have basis of the plant, plant basis. Even they are using many plant and they are taking extract of the plant and they are separating one active ingredient, and based upon that they create a drug. Because they think that every plant has certain useless thing. Only that active principle is useful, others are not. And that's why if you separate that active ingredient, for example turmeric, it is called Haridra. Haridra Ranjate Devi Sarvaso Bhagyadayini. There is no wedding without Haridra, Haldi. Haldi is good for skin, good for eyes, good for diabetes, good for high blood pressure, even it is good for cancer patient. Now what they have done, they are taking one active principle which is called curcumin, and they found curcumin is the main thing and the rest of the thing is junk, they separate. But if you just take curcumin, then it has side effect. But Haridra as a whole is the best medicine. That's why Ayurveda uses Haridra as a whole. We tell the patient boil Haridra with a milk and drink that milk. It is good for tonsillitis, pharyngitis, laryngitis, tracheitis. Very good, because turmeric is antiseptic and it is antibacterial. It works on streptococci, staphylococci and pneumococci. Very good. So in Ayurveda they are using turmeric for skin diseases, eczema, psoriasis. If you daily take turmeric, it will control your blood sugar. And if you take turmeric, it can be used for cut, burns and wounds. Even non-healing diabetic ulcer can heal with turmeric. That's the glory. I'm just giving one example. So in my heart, modern medicine is working on subtle active principle. Ayurveda is working on the substance as a whole. And therefore Ayurveda talks that turmeric, what is the rasa, vira, vipak and prabha? Rasa is the taste. Turmeric is astringent, bitter and pungent. Turmeric is heating. But vipak of turmeric is astringent, which is very beautiful. And that's why turmeric can pacify Pitta disorder as well as Kapha disorder. The fresh turmeric has sweet vipak. Dry turmeric has pungent vipak. Another beauty. So, you will see Ayurvedic approach to the medicine based upon rasa, vira, vipak and prabha. Rasa is the taste. There are 6 tastes. Madhura, Amla, Lavana, Katu, Tikta, Kashaya. Sweet, sour, salty, bitter, pungent, astringent. These are the 6 stages. Virya, heating and cooling, Ushna and Shita. And Vipak is post-digestive effect. So sweet has sweet Vipak. Sour has sour Vipak. But Katu Tikta Kashayanam Vipakaha Prayasho Katu. Bitter, pungent, astringent, their Vipak is pungent. Vipak is the action on excreta, urine, feces and sweat. But Prabhav is a specific action on cellular level. So on cellular level, turmeric is antibacterial, antiviral and anti-inflammatory. It has free radical, it removes the free radical, it is antioxidant enzyme. And curcumin is the active principle that really controls your blood sugar. So in my heart, Ayurveda and modern medicine can go concurrently and inherently together. We should not fight. We should unite. And what a wonderful medicines are there in Ayurveda, and what a wonderful life-saving drugs are there in allopathy. They should be there. It is my prayer that in future in India there will be integrated medical hospital where Ayurvedic doctor and modern doctor, they are working together. They will try to treat the patient with Ayurveda first. If there is an emergency coming, then they can use allopathic medicine. That was exactly the hospital where I was working, Seth Tarachand Ramnath Hospital. It was integrated medical hospital where Ayurvedic doctor and allopathic doctor, they work together. This is ideal. And even in America, England, Germany, recently I received a call from my friend from Germany, Dr. Graminger. She is very loving. She is MD and she loves Ayurveda, and she sponsored me since last 20 years to teach Ayurveda in her center.
Wow.
And she called me, Dr. Lad, there is wonderful things are happening. In Germany, there is an integrated medical hospital and they hire me to treat Ayurveda. Amazing. This is a great thing. So that in future, Ayurveda and allopathy should go together.
Yes, I think we are all hoping for it, and that would be a wonderful world. You know, one of the things that I've observed as I've come to your center and when you have done my Nadi Pariksha is that very often you also see our astrological birth chart. So I want to understand from you, what is the connection between Ayurveda and astrology?
Ayurveda is all-inclusive science. Ayurveda includes astrology, which is called Jyotish. Jyoti means light. And every planet has a different color light. So Jyotish is the light of life. And moment you born in certain place and certain time, that square is the cosmic window. Then there is the ascendance, which nakshatra was rising. That is the first house is ascendance. Then your income, then your brothers and sisters, then 4th house is the mother, 5th house is education, children. So all these 12 zodiac sign and 12 important houses, they are connected to your body. So astrology has astrophysiology, astroanatomy, astropathology, astropsychology and astrotherapeutic. All they are connected like modern medicine, like Ayurveda. So I have studied both Ayurveda and Jyotish, and I found this is wonderful. Jyotish is as deep as Ayurveda.
Wow.
Yeah, it is very profound science. And when you look at the ascendants, that is your Prakruti. 6th house is DC, that is your vikruti. So just by looking at the Prakruti, now when I look at the Prakruti, the 2nd house is the left hemisphere, right hemisphere. 3rd house is the neck, throat area. 4th house is the heart and chest. Likewise, 5th house comes to the womb and 6th house comes to the extremity. So according to the Ayurvedic as well as astrological science, if we look, these 9 planets also they have Prakruti. The Prakruti of sun is Pitta.
Oh.
That's why if you have sun in ascendant, it will be Pitta. Then Prakruti of moon is Vata Kapha. Moon is a fastest moving and moon is water. Prakruti of Mercury is also Pitta and Vata. Then Prakruti of Venus is Kapha. Jupiter is Kapha. So there is some connection between, suppose if you have retrograde Jupiter in your 4th house, you will bound to get tumor in the right breast. 4th house is the right breast. If you have retrograde Jupiter into the 10th house, you will get some problem with the left breast. Amazing. Retrograde Jupiter into the 7th house, woman will get fibroid tumor. So there is some connection between the astrological planetary position and person's Prakruti, Vikruti. That's why I look at that chart, and even psychiatric problem can be seen. If your moon is with Rahu, you are bound to get depression. So Mercury and Mars together will create skin disorder, eczema, psoriasis, urticaria, rash. That's interesting.
Yeah.
And if you see a person has exalted Jupiter, he will get multiple lipoma as well as fatty liver. And I have seen person with Rahu and Moon into the 6th house. I say it is a tuberculosis. I mean, there is some definite relationship between planetary position and the vikruti. So sometimes I use Jyotish, which is ancient Vedic science. Then I love palmistry. It is called Hasta Samudrik. Samudra means ocean, Hasta Samudrik. And there is a lifeline, there is a headline, heart line. And they can also show if the Mars line is touching the lifeline, that person's liver is weak. And liver marma is here. So marma therapy, then palmistry, and then Jyotish, they all go together. Even in my clinic, people bring the layout of their house. And in their house, Vastu Shastra, when the southeast corner is diminished or it is cut off, that person will get GI tract problem. Like IBS, irritable bowel syndrome, or stomach ulcer, peptic ulcer, or pancreatic cancer even, because that is connected to the Agni. If you are missing in the house the southwest corner, it will affect the pelvic floor organ. And amazingly, one of my friends, she invited me for housewarming in Albuquerque, and there was a puja going on. People were enjoying housewarming party, and I just looked, and they were missing. There was a bathroom in the southwest corner. Then my wife asked me, "How about that?" Hey, don't ask me now, because this is not the place to talk. But you know, that corner is missing. She may get ovarian cancer or rectal cancer.
Wow.
And surprisingly, she got that.
Oh God.
Means, house is the environment. And Vastu Shastra, Jyotish, and Ayurveda, they work together. Ayurveda heals through the gemstone crystal. Ayurveda also heals through the herbs, Rasavira, Vipaka and Prabha. And Vastu Shastra can heal the person by removing Vastu Dosha Nivaraka. I mean, you have to remove the Vastu Dosha. Your name, your fame, your divorce, everything depends upon your Vastu.
So one must match their astrological birth charts then?
Of course.
Yeah.
Even you should look at the astrological chart. That is called Guna Melan. Out of 36, you should have 18 qualities matching. And especially 7th house is very important, which is house of spouse. If there is Rahu, Ketu, Saturn, or Neptune, oh my God, that marriage will be a nightmare.
No, nobody wants a nightmare for marriage.
Oh, nobody. So before you jump into the relationship, you should look at your astrological chart.
So basically, if you have a good Ayurvedic practitioner, a good Vastu consultant, and a good astrologer, and you follow whatever they say, you're largely okay.
Of course. You know,
there has to be some solution.
No, apart from that, beyond Vastu and beyond all these things, meditation.
I was going to get to that. I was going to ask you, what is the correlation between Ayurveda and spirituality and yoga? Because that's something that you've spoken about a lot previously. And that has been a huge part of, the Dinacharya suggestions that you give.
Ashtanga Yoga, Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana and Samadhi. These are the 8 limbs of yoga. There is Ashtanga Ayurveda. Even Ayurveda has 8 different limbs. Kaya Chikitsa, Bala Chikitsa, Stri Chikitsa, even Daiva Apashray Chikitsa, which is Ayurvedic psychiatry, then Bala Chikitsa, which is Ayurvedic pediatric, and there is Ayurvedic geriatric, Vriddha Chikitsa. Then Ayurveda has surgery, Shalya Karma, and Shalakya Karma is ENT. So there are 8 limbs of Ayurveda, 8 limbs of yoga. Yoga and Ayurveda, they are sister sciences, they go together. Yogena chittasya padena vacha. They say by doing yoga, you will do chitta vritti nirodha.
What does that mean?
Means cessation of thought construct, cessation of thought wave is the beginning of yoga. Yoga karmasu kaushalyam. Yoga means skill in action. Sthiratvam yoga muchyate. When you make your prana sthira, it is a yoga. Yoga has a great medicinal value. Even asana, every asana has a great therapeutic value. Camel, cobra, cow, boat, bow, breeze, lotus, locust, lion, palm tree. These are the 10 major asana. If you do them and then do package of 8 pranayama, basrika, kapalabhati, anulom, milom, agnisar, then brahmari, then ujjayi, udgit, shitali, shitkari. This package of 8 pranayama, it is beautiful because the ultimate active principle of medicine is prana.
What is prana?
Prana prakarshena anayati nayati iti pranaha. Prana brings life energy. So prana is breath.
Okay.
But prana is a life force. And there are different prana. Ambara piyusha prana, the pranic energy in the ambar, in the akash. Matarishwan pran, in the cosmos there is a pran that is called Matarishwan. Then Murdnista pran, prana in the brain. Then Kantastha pran, prana in the throat. Rudista pran, prana in the heart. Nabhista pran, prana in the belly button. So pran means neuroelectrical impulse.
Okay.
Prana means dynamic force. And prana creates thought, feelings, emotion. So prana is a bridge between body, mind and consciousness. And in Manobhasrota, the eyes are looking at the tree. So the light coming from the tree falls on the retina. It creates inverted image. There is a prana in the retina that catches the optical neurological impulse of the tree. And then it carries through the optic nerve to the optic chiasma, to the external geniculate body, lateral geniculate body, to the occipital cortical area, where interpretation of visual perception is done. All this is governed by prana. I'm just giving one example.
Yeah, that's why pranayama is very important.
That's why pranayama is very important. Ayama means to stretch. So when you take a long deep breath, slowly, you are stretching your prana. Then hold the breath up to your capacity, that is kumbhaka. And when you exhale the breath, it is rechaka. So puraka, inhalation, kumbhaka, retention, and rechaka is exhalation. Yeah. These 3 called pranayama. Whenever you are sad, unhappy, just watch your breath. Take a long deep breath, inhale for 5 seconds. Slowly. And there is a gap. Stay in the gap. And then exhale, still slowly, for 10 seconds exhalation. Then there is a gap. So after inhalation, before exhalation, there is a gap. And after exhalation, before inhalation, there is a gap. In that gap, you exist without breath. In that gap, you exist without prana. That gap is called Chidakash. Chid means awareness. It is a sky of consciousness. It is a sky of awareness. And when you stay there, there is a silence. So, we teach people empty bowl meditation, very powerful meditation. So when you sit quiet, your hand is like an empty bowl, jaw is relaxed, tongue is touching the palate, and don't breathe, let the lungs do their job. When lungs are inhaling, the air goes in, and when lungs exhale, air goes out. In that in and out movement, pay attention to the touch of air inside the nostril. The ingoing air has cool touch, while outgoing air has a warm touch. So for first 5 minutes, sit inside the nose and pay complete attention to the touch of air inside the nostril. Then after 5 minutes, follow the breath. When lungs inhale, air comes into the nose, it touches somewhere, cribriform plate or side of the nostril or septum. Then go with the breath, enter into the root of the nose, go into the throat, go into the larynx, go into the trachea, heart, lungs, diaphragm. Go deep down behind the belly button, and there is a stop. Stay in the stop. In that stop, you exist without breath. In that stop, there is no thought, because thought is a movement of breath. In that stop, there is no time, because time is a movement of breath. And in that stop, there is a silence. In that silence, this is amazing. You stay there. And when you want to exhale, again exhale, come up from belly button to the heart, diaphragm, lungs, trachea, bronchus, then come to the epiglottis, come to the nose, and air goes out. Dwadashanta, 4, 4, 8, 4, 12. So during exhalation, air goes out 12 digits from the tip of the nose in the outer space. Stay there also. So these are two important stops. One stop behind the belly button, and one stop is outside of the body. That stop is very important. In that stop, there is no thought, no mind, no time. And you are in a peaceful state. In that peaceful state, you are surrounded by silence. And in the beginning, you will stay in the stop only for a fraction of a second. But if you practice this pranayama, 10 minutes in the morning, 10 minutes during midday before food, 10 minutes in the evening, and 10 minutes on the bed before you go to sleep. Slowly, slowly, your suspension of breath will enhance. You can easily stay in that stop for 5 seconds, 10 seconds, and within 3 months, you will stay in the stop for 20 seconds. When you stay in the stop for 20 seconds, then you will see the purple light. Then in the right chamber of the heart, there is a small window where there is a pacemaker SA node. There is a small window and beautiful purple green light is coming.
Is that the Vibgyor, the violet that comes to the crown chakra?
Correct. So, this is the important, this is Tattva Mudra. You touch it, your second intercostal space. That is very important. And there is a light. You go into that window and you will see the spiral light moving up right from the coccyx, tailbone, to the sacrum, to the lumbar, and it comes here. And there is a fountain of light. It comes here and it becomes a beam of light. And from there, the light goes to the brain. And you will see, when you pay attention to the Murdni, you will see your brain like a galaxy. Billions of galaxies with light, because your brain is a map of universe. This is Pran. Pran above the crown chakra is Matarishwan. Prano hi Bhagavan Matareshwaram. Prane bhutancha bhavyancha. Prane sarvam pratishtitam. Prano hi Bhagavan Matareshwaram. Matra means mother. Ishwar means God. This prana came from mother through the placenta to the belly button. So belly button is very important. And talu is this. So this energy which moves from the talu to the belly button is prana.
Is that why we put ghee in our belly button also?
Oh, very good. If you put ghee on the belly button, you are nourishing prana. You ask beautiful question, I like.
Thank you. You know, Dr. Lad, I wanted to ask you that there's just so much, conversation about vegetarianism. I'm a vegetarian, I choose to be one. Is that the only way to be Ayurvedic?
Ayurveda, if you look, Charak has given in the food different types of meat. The goat meat, the sheep meat. Even they talk about tiger meat, kravyada mamsa, mamsada mamsa. So meat has a great value. When person has consumption, tuberculosis, he needs certain meat. In that sense, Ayurveda has used different animal product for healing purpose. But once you are healed, then there is no need to kill the animal for the food.
Fair enough.
So Ayurveda says that if you are pretty healthy, just follow vegetarianism. Don't kill the animal for food. For spiritual practice, it is very important to be purely vegetarian.
Can you get enough protein from vegetarian food?
Oh yeah, urad dal is one good protein. Masur dal, protein. Tur dal, protein. Moong dal, protein. All these dals are protein. So there are many vegetarian, almond, cashew. They are also good source of even akhroad, which is called chestnut. They are very good in protein, and omega-3 fatty acids are there. It will reduce cholesterol. So there are many vegetarian food products where there is no need to eat meat. You can beautifully grow with natural vegetarian protein.
Dr. Lad, I've had this conversation with you before where you recommended that we should eat vegetables according to the season. Like seasonal vegetables are what are better, for us. So while I understand that, our Vata, Pitta, Kapha also changes per season, which is why we possibly should have seasonal vegetables. What is your opinion on things like avocado and kale and quinoa? These are the things that you find abroad. They're not even grown in India. Is that something that suits the Indian body type, given that it's obviously not seasonal?
This is a very beautiful question. Many people ask me that question. Avocado, kale, or kiwi, they are coming from the Western world. So, can Indian people eat that? I think yes. Because there is a Vata, Pitta, Kapha, Prakruti here, there is a Vata, Pitta, Prakruti there in the Western world. Then in many Western world, they don't have mango. They should not eat mango. No, mango is rich. It is the king of all fruit. So, I think the apple grown in California, person from New York can eat and enjoy.
Yeah.
Because once we know the Rasavira, Vipaka and Prabha and whether it suits to me, it's okay. So many fruits which are not grown here, but we can enjoy. Avocado. Avocado is, it is called loni gur. Loni means butter. It is a buttery fruit. And people with high cholesterol should not eat avocado. But avocado is good to pacify Vata dosha, to pacify Pitta dosha. And lately somebody found that it is also omega-3 fatty acid. So If your cholesterol is okay, you can eat avocado. So all these fruits, I think anybody can eat. There is no problem. Otherwise, people are exporting mango from here, Alfonso mango, to the whole world. Then whole world will starving. They never ate Alfonso mango. So
No
Ayurveda
need
is
to
very
deprive
all-inclusive.
ourselves.
You can eat any food. First know your Prakruti, first know your vikruti, then you can choose the fruit. I like Ayurvedic concept which is based upon anti-doshic diet. That's
Fair
very
enough.
important.
Agreed. You know, I have done Panchakarma here at VIOA a few times now. But I want everybody else also to know what Panchakarma is and why it's so useful.
Correct.
So if you can just shed some light on what is Panchakarma, what it encompasses, what are the things that are done during Panchakarma, so everybody else can also know how important it is.
Panchakarma is an ancient Vedic, Ayurvedic art of cleansing, detoxification. We can detox liver, we can detox colon, we can detox cardiovascular system. These toxins are high cholesterol, high triglyceride, hyperlipidemia, as well as uric acid is high. In all these conditions, we need detoxification. So Ayurveda divide chikitsa into shaman, which is palliation, and shodhan, which is cleansing. So palliation will take time. But if you do panchakarma, cleansing program, then palliative therapy work faster. So for that reason, every person should receive panchakarma. Because in winter season, we accumulate kapha dosha, vata dosha. In summer season, we accumulate pitta dosha, and in autumn, fall, vata dosha, as well as in summer, pitta dosha. So we have 6 seasons: Vasanta, Grishma, Varsha, Sharad, Hemanta, Shishira. But in America, there are 4 main seasons: the summer, the autumn, the winter, and the spring. So during spring, we accumulate kapha, and kapha creates congestion, cough. So we need panchakarma. During summer, we accumulate so much pitta, people get sunburn, rash, urticaria, eczema, psoriasis. We need to cleanse the pitta. And during autumn, we accumulate vata dosha, people get dirt, dust allergy, as well as arthritis, rheumatism, sciatica. This vata disorder, we need cleansing. And in spring season, there is a pollen, people get allergy. So, at the junction between 2 seasons, it is called Rutu Sandhi. Junctional period between two seasons, because the last 15 days of summer and earlier 15 days of fall, there is a panchakarma. Likewise, ending of the fall and beginning of the winter, there is a panchakarma. Ending of the winter and beginning of the spring, panchakarma. So we can do panchakarma quarterly based upon your diet and lifestyle. So panchakarma is detox program. We do abhyanga, snehana, oleation. And by doing snehana, oleation, we are lubricating srotas. And lubricated srotas, they lose their grip over the arm, over the toxin. And toxic arm loses the grip, so they start coming, rolling back to the GI tract. All vata dosha, which is circulating in the body, come to the colon, and we remove it by basti. All pitta come back to the intestine, and we remove by viration. And all kaphagenic arm come back to the chest and the stomach, we eliminate through woman. And for nasya is another important to remove the residual dosha. So panchakarma is very important to detox the liver, the kidney, the pancreas. And after panchakarma, we do rasa and rejuvenation. And if you do panchakarma and rejuvenation, you will live long. Jiveda sharadaha shatam, pashyema sharadaha shatam. Live happily long for 100 years.
Oh, wow.
Because 100 years is a span of life. And you can definitely have 100 years lifetime if you do panchakarma periodically.
Dr. Lad, what is the relevance of ghee in Panchakarma? Because that is the part of Panchakarma that I don't like at all, the drinking ghee part. But can you explain to us what is the relevance of ghee?
Yeah, that's a very beautiful question. Ghee is the pure essence of cow's milk. Milk into cream, cream into butter, butter into buttermilk, and then you can get butter, cook and dehydrate the butter, it is a ghee. So ghee is pure essence of milk. Therefore, ghee promotes ojas, which is immunity. Ghee balances tejas, which is your cellular intelligence, and ghee calm down prana, the vata. So ghee is very important for lubrication. Internal oleation, we give ghee. But those people whose liver is fatty, whose gallbladder is stagnant, they hate ghee because ghee makes them nauseating. So too much ghee for Pitta Prakruti, they do not tolerate, because Pitta is oil, bile is oil, ghee is oily, and high Pitta people, they hate ghee because that make them nauseating.
Like me, I am high
Yeah,
Pitta.
yeah. So in that case, but if you take ghee in moderation, on the first day 1 tablespoon 3 times a day on empty stomach, second day 2 tablespoons 3 times a day, and third day 3 tablespoons 3 times a day. So this is called krama vruddha, means gradually increasing till you get lubrication. Adatsa sneha darshanam indriyanam chatarpanam, means you should pass ghee through the stool, you should pass ghee through the sweat, you should pass ghee to your eyes, nose, everything gheed out. So that is a well lubrication. And when you do sroto mukha lubrication, then the toxins from the deep connective tissue, they start rolling back to the GI tract. And then we remove them.
Through basti.
Dosha yanti tata tebhya sroto mukha vishodhanat vruddhya beshandanat pakat koshtam vayuscha nigrahat. Vayu nigraha is pranayama. So when you do pranayama and hold the breath, you are bringing dosha back to the track. This is amazing. So pranayama is like a daily panchakarma.
Oh, wow.
Oh, I love pranayama. And panchakarma is pranayama you should do periodically. So there is a deep connection between Ayurvedic diet, lifestyle and panchakarma, and yogic kriya, yogasana, pranayama, mudra. Wonderful. So yoga and Ayurveda are concurrent and inherent. They go together, they share together, they explore together the hidden secret of perfect health.
Wow. I will take that with me. One of the things that I had read, and I really wanted to take your opinion on it, was that I read disease is dis-ease. When either your mind or body is not at ease, it is what leads to disease. What is your definition of disease and how do we stay away from it?
Oh, wonderful. Ayurveda has given many definitions of disease. Disease is called vyadhi. Vyadha means to kill. That which kill the system, that which kill the cell, that which kill the organ, that which kill the organism is called vyadhi. That is one definition. Then disease is called papma. Pap. Pap means sin. To eat wrong diet, wrong lifestyle and wrong environment is a papa. Papa means bad deed, bad action. That is the disease. Then there is also disease is called roga, ruja. Ruja means pain. That which create pain, pain in the joint, pain in the tummy, pain in the eye, pain in the head, pain in the heart. So ruja kartutvat rogaha. Disease create pain, disease create bad action, and bad action create disease. So jvara, atanka, papma. Jvara means fever. Deha indriya, mana santapaha. So there are so many definitions of disease. But the best definition of disease is given by Madhava Nidan. Dosha, dosha, sammurchana, janito, vyadi. Aggravated dosha, attacking tissue. And there is a mixing of the dosha and dhatu. Dosha, dhatu, sammurchana. It is amalgamation of dosha and dhatu. So the dosha's quality attack the quality of the dhatu and it creates altered status of the dosha dhatu.
What is dhatu?
Dhatu means bodily tissue.
Okay.
There are 7 bodily tissue. So rasa dhatu, plasma, serum, cytoplasm. Rakta dhatu, blood, RBC, WBC, platelet. Then mamsa dhatu, muscle, smooth muscle, striated muscle, cardiac muscle, skeletal muscle. Meda, adipose tissue, fat, cholesterol, lipid. Then asti, the bone, the cartilage. Majja, the bone marrow, including nervous system. Shukra, the male, and Artava, the female. So these are 7 dhatus. So one of the definition of Madho Nidan is aggravated dosha, leaving the GI tract, koshta, entering into the general circulation, and they attack the tissue and create altered status of the dosha dhatu, mala, vijnanam. So, this definition of Madho Nidan is very beautiful, that dosha dusha sammurchana janito vyadhi.
So keep your doshas in check, then they won't
Correct,
attack the
correct.
tissues and then you won't have
That's
disease.
the beautiful practical
Yeah.
definition. So, there is another definition, dis-ease. When you are as it is, at ease, you are happy. But when you are at ease is disturbed, it is called disease. So that is one of the definition of disease. But this disease, the definition of disease, according to Veda, is not knowing yourself.
Wow.
If you do not know who you are diseased. Means you are the pure soul. You are the pure awareness. Don't judge yourself. Moment you start judging yourself, criticizing yourself, hating yourself, it is the beginning of disease. So this is another disease. Atma ajnanam rogam evacha. Means if you do not know your true nature, your true self, you are diseased. You are covered by screen of Maya. Maya is illusion.
Yeah.
Maya is delusion. Maya is ignorance. Maya is confusion.
Agreed.
Yeah.
Very well said. I'll take that back with me. The last question that I want to ask you is that, as youngsters, what would your advice be to people like myself on just, the most simple basic practices that we can incorporate in our dinacharya, in our daily schedules, that is going to just make our life healthier and happier? And what is the best way for us to just unwind after us?
Wonderful, gorgeous question. The real medication is meditation. Meditation is medication. What is meditation? Moment to moment awareness of what is. What is around you, what is within you. And maintain the inner harmony, inner balance, inner glory. We forgot ourselves. We don't know who we are. And our life is a relationship. There is no happiness in the relationship. There is no clarity, no compassion, no care. Such a kind of relationship is a prison. Right?
I agree.
So, one thing to bring perfect health, the physical, the mental and spiritual health, is moment to moment awareness. So you should practice self-awareness. Be aware of your thought. Be aware of your emotion. Be aware of your reaction. And use your relationship as the mirror, and in the mirror of relationship, watch your thought, your fear, your anxiety, your insecurity, your loneliness, objectively. This demands a great deal of awareness.
Yeah.
And when you are aware, that awareness is freedom, that awareness is love, that awareness is clarity, and that awareness is compassion. That awareness is Satyam Shivam Sundaram. Satya, the truth. Shiva, the holy, the sacred. Shiva means innocent, and Sundar is beauty. You are beautiful, you are loving, you are compassionate. But you do not know your beauty. You do not know your true nature. So, this is the real practical Ayurveda, to be moment to moment awareness. Never forget watching your thought. Then thought will be crumbled. Thought will be scared to enter your mind, because there is no way that thought can come without your permission.
Yeah, it's true.
And
hard to do, but true.
So you will see that awareness is the key. And look at the tree, the beauty of the tree, the flower, the lovely light on water, a beautiful face of a woman, or very charming face of a baby, the child, or even so-called crooked stone. Crooked is not stone, and stone is not crooked. But when there is a evening light fall on the stone, that stone looked divine.
Yeah.
When I went to the Washington DC, I saw some museum, and they say, "Oh, this stone brought from the moon." And there was a dark room, and only light was focused on that piece of rock. And everybody said, "Oh, this is the stone from the moon." I said, there is no difference between that stone and stone on the earth. On the contrary, stone on the earth is more beautiful. But it is kept in the museum. And it is kept in the black, dark surroundings so that your attention will go only to the stone.
Yeah.
This is the key. When your attention goes to anything particularly, like the tree, the flower, the bird, the mountain, that attention becomes beauty. That attention becomes compassion. And that attention is a flow of awareness with prana. So, our life is beautiful.
And we should value it.
Our life is gorgeous.
Yeah.
We should appreciate our life as it is.
Yeah.
And that demands a great deal of awareness.
Yeah.
No comparison, no competition, no violence.
Yeah. Thank you, Dr. Lad, for your time and this wonderfully insightful conversation. And I really look forward to seeing you again super soon next year for Panchakarma at the Vasant Institute of Ayurveda. And I will, of course, continue to learn from Ayurprana. And thank you for introducing Ayurveda to our lives.
Thank you, thank you. Ayurprana, Ayurvedic Institute, and Vasant Institute of Ayurveda, they are one.
Yeah.
They are doing great work
Yeah.
of healing, spreading Ayurveda, teaching Ayurveda, and helping the people through Panchakarma and enhance their span of life for 100 years.
100.
Thank you.
Thank you.